Alrighty, hey everybody, we are here just outside of East Palestine, joined here by Aaron Bragg. You've seen Aaron on the channel before, both on my last visit here to East Palestine, as well as we've been keeping in touch remotely. Aaron's been very helpful whenever we're kind of asking some of these questions regarding, some of the tank cars, some of the testing data, all of that sort of stuff. Aaron's been a good asset for us to be able to provide some information to all of you about what's going on here. He's somebody who's been kind of trying to keep the fight alive, pushing for more information surrounding testing data, getting questions from some of these agencies answered. We're going to start off today, though, with some new kind of information that was put out in the month of April from Aransco, which is the Ohio River Valley Water Sanitation Commission. We'll kind of get into some of this data. I guess first off, do you want to explain a little bit what we're looking at here, and we'll make sure folks can see this on screen as well.
Sure. So this is actually new data that I was just made aware of as well. The Ohio River Valley Sanitation, they have real-time monitoring up and down the Ohio River and do a lot of the waterway sampling. So they did samples in early April, it looks like the 3rd through the 4th at several locations. And there are still chemicals of concern that they picked up as far away as Parkersburg, West Virginia, even in higher indications closer to the train derailment. So what makes that curious is the Ohio EPA has came out over these last several weeks and said everything is good, the water's clean. However, this data, while maybe published, is not being communicated to the residents.
Yeah, definitely not. And I mean, just picking out a couple of these on here to give folks an idea. We've got spots along Little Beaver Creek, which is, the waterways, just to give folks an idea. Starts Sulphur Run, is right next to essentially ground zero of where the derailment happened. Sulphur Run feeds into Leslie Run. Leslie Run eventually bumps into Little Beaver Creek, which then hits the Ohio River eventually. So we've got spots on Little Beaver Creek. Parts per billion of 12.5 of N-butyl acrylate, one of the chemicals of concern from the derailment here. We've got spots further down Wellsville, Ohio, in the Ohio River, 2.94 parts per billion of N-butyl acrylate. These shouldn't be showing up in the Ohio River in a lot of cases. That's just picking out a couple of them. We also have some of this information. It's showing present for ethyl hexanol, ethyl hexyl acrylate. It's showing present, but not giving us numbers.
Exactly. So what is this? I mean, they're finding it, but they're not letting us know. And again, folks, they're telling us everything is clear. However, we're still finding these things out.
Yeah, definitely concerning. Again, to see this stuff as far down as the Ohio River is surprising. That should be setting off major red flags, especially that, again, this sampling was done in the beginning of April. It's not like this was, a week after the derailment. This is months later. We're now approaching 3 months later at this point. So certainly not good to be seeing this. So we'll definitely be looking more into this data in the future. We'll see if when you start to dig more into this, if you find anything else out or are able to get more information, definitely let us know. I know that you have been working with United for East Palestine, been able to get out on occasion with Dr. Welton and his team when they've been here doing the independent testing that I know folks in the region are very grateful for that, that happening, and Dr. Welton and his team, some volunteers, to my understanding, all come out with him as well to help out. Welton actually sent a open letter to the EPA. I talked about it a little bit a couple weeks ago when he sent that out, describing some of the response from the EPA here as, and I'm quoting, a substandard and poorly thought out execution of the plan. That's obviously, we see that. I've been saying these sorts of things, but it to me, and I believe to a lot of residents here, when you hear somebody who is an expert in this sort of stuff using that sort of language to explain it, really raises the red flags. Do you want to talk a little bit about what is included in this letter here? Again, we'll make sure folks can see it on screen, and why some of this is so important to what we're dealing with at this point.
So I'm also working with the Unity Council in East Palestine as well, and it's really not that I'm affiliated with anybody. We are just trying to anybody and everybody to try to get us help. Dr. Walton has been absolute godsend to us by really driving the bus to hold the EPA accountable. First and foremost, the thing that we are all missing is the plume, a model. A model of the plume above ground and below ground of the chemicals of concern. We have heard several times from the EPA that there's modeling there. However, they have not published this modeling. So in other words, there is no model.
Right.
Until they publish and put this up front on their website, what is the testing for? How can you perform any type of testing if there's no modeling done to develop your testing? Right. So that is, first and foremost, the biggest concern that we have right now. We are 3 months into this, and we have yet to see a model for the chemicals of concern. They spoke of over 200 different chemicals in their, I believe, their February 21st directive where they took charge of this. Again, where's the modeling? So, if we don't, what's the purpose of testing if we don't have a model? I mean, please, EPA, release that model so we can get independent scientists to look at what this is and maybe help us with some of that.
Yeah, and I mean, even from the beginning, obviously, we've talked about this a little bit already, but, February 3rd, the derailment happens. That's on a Friday. Sunday night, according to the EPA, Mark Durno, at one of the town hall meetings that happened a couple weeks ago, he said the EPA had developed modeling for a 1-car of vinyl chloride vent and burn. And then you fast forward to, the next morning, Monday morning, and Durno says that the EPA at that point, it wasn't their decision, but that it was now a 5-car vent and burn. The EPA wasn't consulted about it.
Why did the EPA allow the burning of 4 additional cars when there was only issue with 1?
Yeah, so we did not authorize that. We are not, when we're in that phase of the emergency, we don't make that decision. We provide input to those decisions. And what we provided was an adequate, we helped develop the modeling for what the air was going to do when the plan was just to burn 1 car, right? Because that was the original plan. That night, Sunday night, the plan was vent and burn 1 car. On Monday, we learned that they made the decision to vent and burn 5 cars. We weren't part of that decision.
But you guys knew
before the vent and burn happened, we knew it was happening, so we enhanced our air monitoring equipment to be able to handle something more.
Was there nobody who could say, nope, you're not going to burn 4 additional cars?
So
when that wasn't in the plan?
It was our understanding that there was a significant risk of explosion, and that was the rationale behind it.
It seems to me that there was no model to make that decision at that point, and to your point, even now, 3 months later, there's no model, and obviously this model would probably be different now because it's already happened. You can easily model this stuff out. The data should be there.
Absolutely.
Yeah, I mean, they're trying to find this stuff without a map of where it should be, basically.
Well, I feel like they're not even trying to find it because, again, we don't have the model. Where's the risk assessment? Again, going back to the EPA admitted to us that their modeling that they performed was on 1 car. Now we had 5 cars that they blew up amongst everything else that was in there. Their own February 21st directive, they talk about 20 cars in that directive. However, in their own document, there's only 19 cars in there. So, I mean, there is a lot of inconsistencies with this. But again, I cannot stress enough. Without a model, none of this testing matters.
Absolutely. And I've been speaking off the record with a former EPA official. He's got decades on the job. I'm working on getting this person on the record, but we'll see. So if you're watching, but this person's described to me in a lot of cases, these agencies, the EPA included, will kind of go into a situation, and if you don't test for it, everything's fine. Yes. If you didn't find it, it's not there, and that's not to say that everybody in these agencies is doing that, but to me, it's at this point, it feels like either the people in charge are severely incompetent in a lot of cases, or there's at this point like almost bad intent. I don't. It's hard to say. I don't want to think that.
Exactly.
But it's been months. We've seen what happened here. I did a little bit of investigating into the incident down in Indiana with the plastics facility catching on fire, and I reached out to the EPA with a lot of questions there. Very selective answers that I received. Lots of questionable decisions made. So even if it was something like, oh, we weren't ready for something like this, well, the EPA, same Region 5 EPA again, dealing with this in a haphazard way in yet another location.
They've had 2 months practice here before there. So in solidarity with the folks in Richmond, Indiana, God bless you guys, and I hope that Lewis and the team will bring up, keep the foot on the accelerator for you guys as well. To correlate back to the April 12th letter that Dr. Welton sent to the Administrator Reagan, it goes back to just what he's saying. There is such a disjointed response to the well sampling. That's what this letter is about. So the county is doing a set of sampling. The Norfolk Southern is doing a set of sampling, and the Ohio EPA is doing a set of sampling, and not all three agencies are doing the same set of sampling. Dr. Welton's taking the samples that we took in, I believe, about 17 residents' homes, were a lot more broad in scope. And this letter really was about the results that they gave to the residents with over 200 chemicals on there without any type of explanation and what types of chemicals they were, and they just literally dumped this onto the resident and said, hey, figure it out. There's about 15 or 16, I believe, that were above the action limits. However, they did not explain what those action limits were. So Dr. Welton was, I believe, trying to stress to the EPA administrator that, sir, you need to be doing a much better job in coordinating the sampling and furthermore explaining what these results are to the residents.
Right, because frankly, and we'll make sure we can put this on the screen, but I'll even flip it around right here just to show. I mean, these water sampling results are pages that look like that, small font with very complicated names and all sorts of numbers in difficult to understand format. There's no like, if it's above this number, you should be worried, or if it's above this number, this is what it means. It's just raw data, essentially, handed to these folks with little to no explanation. That's a major red flag. You would think the EPA is coming in here. It's great that tests are being done, right? We want to see tests, but the tests are no good if people don't understand them and don't understand what their next steps are after they receive them.
And with the disjointed response. And that's what Dr. Welton wrote this open letter to the EPA for was, hey, folks, look, this is what's happening. What is the action plan that you're going to go with now? Do we have a set of guidelines? It's been almost a month since he's asked for these. Has these agencies that I just mentioned, have they developed a plan and a set of rules in order to do this testing to where it is more combined?
Right.
As a matter of fact, I actually talked to Senator Brown about this 2 to 3 months ago, and his director, the U.S. FDA director, Mr. McCracken. I had a good 2 to 3 minute conversation with him just about this, asking for this exact same letter that Dr. Welton had to send out again 2 months later. Here we are 3 months, and nothing has occurred.
Yeah, no, it's a little outrageous, and especially when I see how complicated this is, which it should be very straightforward. You would think, again, incidents like this, generally to a much smaller scale, but incidents like this happen. There should be a playbook, essentially, of, okay, here's how water sample results should always be formatted. It should always come with this booklet of information with it that says what these action levels are. It's clear that is not the case, and again, unless there's some major incompetencies going on here. And the same, not the same agencies, but you've got the CDC now in some cases. Speaking of testing, it's a different kind of testing, but residents in town have started doing vinyl chloride testing for the metabolite in their urine. The CDC has essentially said residents should not have this sort of testing done for they had about 4 or 5 reasons, but I went through last night and kind of looked at those reasons, and one of the main ones is essentially the data is hard to read. I don't know about you, but this looks hard to read to me too, but this doesn't stop them from doing that. Another one of them was they're a little bit worried about the accuracy of the tests. At one of the town halls, Mark Durno himself admitted that the devices being used for the residential home tests aren't picking up certain chemicals and whatnot, so they're not worried about the accuracy when it comes to home tests, but they're worried about the accuracy here. It was kind of thing after thing. I went through this list. One of them was just the turnaround times are long. I'm sorry, but this was a major disaster, and we're talking that there are federal government agencies here. You can't expedite the process for these people. So, it's some of these agencies are saying, oh, these are issues, that's why you shouldn't go test for them, and then it's not preventing other agencies from doing the testing. I think that the testing should be done broadly. You should go through and follow these models that aren't, obviously we don't have yet. There should be a model that lays out these are what need to be tested for within these regions, and then go through and broadly test these areas that are affected for these things. But instead, the tests that are getting done, you need a doctorate to be able to understand the stuff.
Other curious thing about this lab that they used, Stantec, they are not QA or QC qualified. So these readings really mean nothing without having a lab safe standard. They're not even following their own standard. So
is Stantec the contractor for Norfolk Southern?
This is, I believe, an EPA.
Contractor.
We're going to have to look into that. That could be EPA
Either way.
or regardless, if you're doing something that's not a QC, QA qualified lab, it means nothing.
Right.
To bring you up to speed on some other testing that's being done.
Yeah.
Benzene as well. So I know anecdotally of 2 residents recently that had benzene in their blood. And these residents, I was told the sulfur run, the highly contaminated creek, runs under their homes. So folks, we are getting exposed on a daily basis. And again, it's not up to us to prove to the EPA and the powers that be that there's things wrong. It's up to them to prove to us that it's not. Now, they... based on these clusters, which we have now, so I believe it's up to 23, 24 folks that have these metabolites for vinyl chloride. Whether they are poo-pooing this or not, why isn't the CDC involved?
Right.
The EPA is the incident commander. The incident commander should now bring in the CDC and prove us wrong.
Right.
Okay, whether you take those 25, 26 residents that have come up positive for these metabolites, let's now look at where these residents are. To me, this only makes sense. Okay, you got 26 residents. Let's start testing their neighbors and see if their neighbors are coming up with it. And then if they are or they're not, then we can disprove whether it's happening or not. And frankly, for them at this point to not bring in the CDC, they don't care.
Yeah.
The EPA does not care. That's the only thing that we can say, because it's a very dangerous thing that residents have these metabolites in their blood, and we now know with benzene. Let's find it.
Right.
Okay, so what I heard at the EPA meeting last week was we're not finding it at the fence. We're not finding it at the fence. And what they mean by the fence is where the Tioga bus is driving up and down, and they have all their air monitoring and sampling equipment around where the dig is. But guess what, folks? We just talked about in the very beginning of this interview about we're still finding chemicals of concern 20, 30 miles away from this. So guess what? That means our chemicals are highly contaminated in our creeks, and guess what? This stuff comes up and it vapors off.
Right.
So are the folks getting contaminated that way? Again, it's not up to me to figure that out.
Right.
They should be figuring this out.
Yeah, absolutely. And again, this is also a concern that, to your point, you said you've heard of 20 or so, maybe 30 people who are having this vinyl chloride metabolite found in their tests. a chemist that I've been speaking with, he said that metabolite, and while those tests aren't perfect, he said that isn't something that would be from exposure right after the derailment. That metabolite doesn't stick around. The test is for, I might be butchering the name, but thiodiglycolic acid. That is the metabolite that your body creates when you're exposed to levels of vinyl chloride. It should kind of go through your system in a couple days. The fact that residents, like we spoke to 2 of them yesterday, we're going to be speaking with more of them on this trip. One of them after I'm speaking with you, they're testing positive for it, and they've done these tests in the last couple weeks.
Yes.
To me, that says these people are potentially still being exposed to it, and it's not just me. This chemist that I'm speaking with, he's saying, you know what, there are other ways to get exposed, to have this metabolite pop up. Yes, but they are uncommon, and the fact that this many people now are starting to test positive for this is leading to a sign. So to your point, yes, they should be going through now and being like, okay, if these people are testing positive, let's test their neighbors. Really what should have been done, though, was weeks ago when the state of Ohio opened their clinic and that in the beginning didn't provide any testing, didn't provide any actual, prescriptions, didn't provide any actual diagnosis of any kind. They should have actually treated it like a clinic and started testing people who walked in the door, and then over time testing them again and be like, okay, you came in today, this week, come back in a week, we'll do another urine test. The amount of data that we would have if that were the case, we wouldn't be asking these questions anymore. You would think that, to your point too, there's no risk assessment, there isn't modeling. It doesn't seem like there's a coherent plan. If there was a plan in place, this stuff would have happened.
It all goes back to that modeling, correctly, right?
Yeah.
So it all goes back to the modeling that they've never done. They say that they've done it, but again, Ronald Reagan said it, trust but verify. So show us this. Now, we also have seven CDC workers that got sick as well.
Right.
If that didn't trigger the incident commander to say, hey, where were they at when they got sick? Right? Okay, they got sick in this area. If they gave a shit, then they would have said, okay, they were in these areas. Now let's do simple testing.
Yeah.
Simple testing with the neighbors on either side. Prove or disprove it that way. I mean, to me, that's your basic risk assessment models that, frankly, they're not doing. They're not doing. And until they do that, we are hosed.
Yeah, no, I agree. So there is a meeting this coming Thursday that the EPA is putting on. You'll be in attendance. The meeting will be live streamed, so we'll be sure to tune into that and keep an eye out for some of your questions and whatnot. I guess what sort of answers are you hoping to get? We might have covered some of them already here, but I guess what are you thinking? What are you expecting from the meeting?
First and foremost, so is the modeling question, right?
Yeah.
The modeling, it all starts from there.
Yeah.
And until we have a model, and I'm going to give them 24 hours to produce it.
Yeah.
Hopefully maybe they see this and because here's what I observed last week at the meeting. This is a complete PR thing now. So they're not really worried about giving us the data, giving us the information. They're trying to bury us in data point hell. So unfortunately, I kind of threw up a softball question because they were talking about butyl acrylate. Well, my question was, we know from this reading from Aransco that there's the 2-butyl hexyl bad stuff, the other hexyl bad stuff that's there, right? So we know that stuff is still in the creek, so I asked specifically, I mentioned acrolein first because we knew that the acroleins were there. Well, they jumped on that. And the EPA person that was in charge says, well, Aaron, yes, we're looking for acrolein, and he made 7 clicks and rolled 20 pages down and said, well, right there's the data point that you need. So that's not something that any of us should have to worry about. Publish this data. Put it in a simple format for us to do that way. But what I was getting at is they they were calling everybody by name and questions that they couldn't answer. They say, well, come to our office and we'll answer that one-on-one. They're dividing us.
Yeah.
And that should be something that they should be giving out to everybody.
Right.
They should not be bringing me in and doing backgrounds on me.
Right.
I don't know what if I go into their office and then they start asking me a million questions and trying to figure out my social media and trying to figure out a way to tamp down.
Yeah.
Because there is basically, in my opinion, these meetings should be clear full.
Oh, yeah.
Every freaking resident in town needs to be as concerned as I am and everybody else is with what's going on. But the EPA and Norfolk Southern have done a good job at dividing folks. And now there's, let's just say, 20 troublemakers left.
Yep.
And they're working on trying to squash us 20 troublemakers. So, first and foremost, the question is, where's the modeling? Publish it. Second, where is the template for what Dr. Andy Welton asked the director of the EPA, Mr. Reagan, for? He's pointing out, what is his exact words?
Oh, the
Substandard and poorly thought out execution. So he put you on blast with that. You guys have had a month to come up with a template. Is that template there? So that is my second question. I want to see that template. And if it's not there, again, I'm going to give you 24 hours to produce. And if it's not there, you haven't done it. And then where do we go from here? Right? We got to end on a positive because, again, like you said, I don't want to believe that this is all malfeasance or there's a greater conspiracy going on. But if there's all this incompetence that we've seen, let's fix it. We can take this all the way back to 9/11. For months and years, the air is safe, everything's fine. Jon Stewart, with all his power and prestige and one of the most highly rated TV shows, took that man 17 years to bring justice to the biggest city in the United States.
Right.
We are freaking East Palestine, Ohio.
Right.
Nobody cares about us. We don't have Jon Stewart here fighting. So, it's Dr. Welton. Really. Dr. Welton is like leading the charge on this, and he is presenting you guys with open letters and questions, valid, data-driven questions that if they're not answering him, they're not going to answer us.
Right. Yeah.
So, and what I'm hoping to do with the Unity Council as well, and we're working on that, is coming up with a concise list of questions and demands that we need from the EPA to hold them accountable. And hopefully we can have that developed by Thursday and be able to actually hand that to the EPA and to the residents. So now we have something written for them that they have to actually respond to a data-driven question and not try to squash us with PR.
No, absolutely. Well, seems like there's a lot still moving forward with all of this. We're gonna definitely stay in touch. We'll definitely be sure to reach out after the meeting on Thursday too, and see how that went. Fortunately, there are still folks like you. You mentioned they're trying to squash you all still,
yes.
but the unfortunate reality is no one, to your point, is coming to save the day. You would think that some of these agencies would be here, working more so on your behalf, being more clear. The reality is that they're not. Hopefully that changes, but thanks to folks like you, Dr. Welton, several of the residents who are still raising their voices and trying to get this out there, they're able to make it happen. Unless there's anything else you want to add, Aaron, thanks so much.
Just really want to thank you guys enough. And look, I'm going to do the begging for money for these guys.
Yeah.
So, these guys are the only ones right now that are keeping this in the spotlight. And not only us, Richmond, Kalamazoo, this stuff is happening all across the country. And if it's not for reporters and companies like Status Coup to keep the small people in the spotlight, nobody's ever going to get justice or answers. So please donate what you can. A couple bucks, you know. I know you had a rough trip getting in here. I mean, you know, he's the only one that's coming and doing this, and Jordan and everybody else. So thank you guys, and I really appreciate this opportunity.
Thank you for saying that. We appreciate it. And yeah, we're gonna keep trying to come back. This is my 3rd trip to East Palestine. Jordan was just in Flint last week. It was his 20-something trip to Flint. 19th trip. Still a lot of trips to Flint. If you do want to help us out, statuscoup.com/join is the place to do so. And we'll also put a link for folks who want to help the cause with Dr. Welton as well, continuing to do the testing. We'll put a link for that down below as well.
So again, solidarity with Flint. So, and that correlates to us, right? So Jordan has been there 19 times, fighting for 9 years. The EPA, Mark Durno was in Flint, right, folks? Mark Durno was in Flint 9 years ago trying to run the PR there, and nothing happened. So here we are, right? Now, they bring the same guy down here to try to squash us. So, look, this is a long-term battle, and we need all of your support to help us.
Absolutely. Aaron, thank you.
Thank you so
Appreciate
much,
it.
Lewis.
Yeah.